Hey everyone, welcome back to the FU Cancer podcast. So, back in 2020, the Journal of Nutrition published a paper stating that cancer survivors reported a higher prevalence of dietary supplement use when compared to individuals without cancer, to the tune of about 70.4% of cancer survivors reporting taking supplements. And more so, researchers went on to state that nearly half of people using dietary supplements did so without first consulting with a healthcare practitioner. So, here to talk with us about dietary supplements and hopefully answer the question, are they safe, is registered dietitian nutritionist Dr. Krystle Zuniga. Dr. Zuniga is an experienced clinician, educator, scientist, and science communicator. She teaches in the Department of Nutritional Sciences at the University of Texas at Austin, is a board certified oncology dietitian, and owns a private practice, Cancer Nutrition HQ, where she strives to combat misinformation, share the latest research in nutrition and cancer, and translate the science into everyday actions that cancer survivors can take to support their health and quality of life with nutrition. Dr. Zuniga is also the founding board member of Moving Beyond Cancer Collaborative, a nonprofit that provides accessible and affordable integrative oncology health and wellness services. Thanks for listening to the FU Cancer Podcast. My name is Christina Rollins. I'm a dietitian, mom, and wife to a pretty awesome cancer survivor. We said FU to cancer nearly 25 years ago and are still going strong. I'm excited to share the FU Cancer movement, where we are a community of survivors, fighters, caregivers, and advocates, connecting our shared experiences, passion, and determination to live a holistic and well-balanced life. Stay tuned, because we've got a lot to talk about. So, Doctor, thank you so much for joining us today on the FU Cancer podcast.
Well, thank you for inviting me. I look forward to our conversation.
So let's start with the basics. What do we mean when we say, quote, dietary supplements?
So dietary supplements are regulated under the Dietary Supplement Health and Education Act of 1994, and that's commonly known as DSHEA. And as part of this legislation, they actually defined what dietary supplements were. And these are products that are intended to supplement the diet that contain one or more of the following ingredients, like vitamins, minerals, herbs, botanicals, individual amino acids, or any combination of those. So that could include anything from your multivitamin, collagen powders, protein powders, ashwagandha, turmeric. What was really, though, important to understand about this definition of dietary supplements is that this helps set them apart from drugs, and therefore they're going to be regulated differently than drugs.
So, why are we seeing a higher prevalence of dietary supplement use specifically in cancer survivors?
I'm glad you brought up that study. That's a common study that I bring up too on some of these statistics is we're seeing that the whole population is using supplements more. So it's estimated that there's over 55,000 different dietary supplements in the US alone, over $53 billion industry. So it is huge industry. And we're seeing that many Americans are using them, but as you reported, cancer survivors are using them more. And I think there's a variety of reasons that that could be going on. One that something I see as a clinician is that cancer survivors are trying to do everything possible to support their health and to optimize their outcomes. So they're looking for every possible tool to support their health. Also, as I mentioned, just how big the industry is, they're seeing it everywhere. It's being marketed everywhere. And you can literally get dietary supplements at a convenience store. They are really that convenient to get. And there's lots of marketing and snazzy things that are saying that it's going to help support their health. So they're also bombarded with a lot of that as well. And also something that you reported in that statistic is that many don't tell their healthcare providers. And I don't think that's because they're trying to be sneaky about it or lie to their providers. I think that's a sign that many think that because these things are natural or that you can buy them anywhere, that they're safe. And they generally think that they're safe. So I think that whole combination of things, it being a big industry, people want to do everything possible for their health, and then also this assumption that they are safe, people are more and more likely to try them.
Well, we know that not all dietary supplements are the same with respect to their mechanism of action and their absorption in the body. So, what are the different types of dietary supplements on the market and how do they differ?
Yeah, so as I mentioned, over 55,000 different dietary supplements, so we can't possibly go over all of
Mhm.
the types, but it is important to recognize that there is varying ranges of amount of data that we have on safety and efficacy of different things. Like we've been studying vitamins and minerals and what they do in our body for quite a while.
Mhm.
Some of these extracts and herbs and botanicals don't have as much research behind them, so we don't know as much about their safety and mechanism of action. But even the ones that we do know more about, so for example, vitamins and minerals, we can't make the assumption that more is better. I can share a story on that maybe later. But for example, minerals, some of them compete with each other for absorption. So consuming too much zinc could impact how much copper you're able
Mhm.
to absorb, right? So even
Mhm.
minerals have interactions with themselves. Water soluble nutrients, most of them, if you consume in excess, you can excrete it, but
Mhm.
some of them do accumulate. And one example would be like vitamin B6, that high doses for long periods of time can actually lead to like, neuropathy. Some high amounts of fat soluble vitamins, those can accumulate as well. High amounts of vitamin A over time could cause liver damage. High amounts of vitamin D in excess of what you need could lead to hypercalcemia. So we have to be really mindful that dietary supplements is a huge umbrella of things, and they have different functions, different safety levels, different amounts that can be absorbed.
Mhm. So I think a bit of a loaded question as we again say 55,000, opportunities. But the big question is, are these supplements safe for routine consumption?
Yeah. I think it's important, as you're saying, to not make a general assumption about safety. I think people need to be aware of what these regulations are so that they can make a more informed choice. Because I think one of the most common misconceptions I get from people is that they think that they're safe because they are natural or over the counter. And they are regulated. Like I said, the Dietary Supplement Health and Education Act, that's part of FDA's regulations, but they're going to be regulated differently than drugs, right? So drugs need to prove that they are safe, that they are effective, that the pill that you're taking is pure and we know exactly what's in there and there is nothing else. We don't have that same safeguard in place for dietary supplements, right? So no supplement company has to prove that their product is safe or effective or pure before it's allowed to be sold. So it really is a buyer beware market. And I try not to scare people too much, but I do like to give some examples here is one, there could be microbial contamination. Herbs and botanicals are plants, right? So there could be, they're dehydrated, so they get a little more concentrated and perhaps heavy metals or pesticides. So we have to be careful about what's in those products as well. There's been examples where some products actually don't have any of the active ingredient. A ingredient gets a lot of popularity and supplement manufacturers are like, okay, we'll start making that or putting that in a bottle. And there's been some consumer testing to find that those things don't actually have what they say that they have. But on the other end, there's actually been some scary examples of where pharmaceuticals, even banned pharmaceuticals, have been found in some dietary supplements. This tends to be more of an issue with things like weight loss medications, bodybuilding, type of supplements. Um, what was the other one? Oh, like sexual enhancement types of uh, supplements. Those tend to actually get a little higher incidence of those being contaminated with active drugs. And I think that's just an example of how easy it is for some of these products to be contaminated and unpure, right, and adulterated. So some concerns there. That's kind of the product itself. I kind of want to get into the way that it could impact safety in an individual once they take it, like
Mhm.
what could be happening after they take a supplement. One of the concerns, and I think especially relevant for cancer survivors, is that some herbs and botanicals can actually interfere with the metabolism of some drugs. And so there is an enzyme system that metabolizes many drugs. Some are even, one enzyme in particular, CYP3A4, over a third of chemotherapies are metabolized through this enzyme. So if an herb, a botanical that you're taking as part of a supplement interacts with that enzyme and impacts that enzyme's function, you could run the risk of getting less effective drug or in some cases more of the drug, and that can increase the risk of toxicities or adverse side effects. One specific example, and this actually was a small clinical trial, women who were taking tamoxifen when they took turmeric, there was actually less of the active drug available when they were taking turmeric because of that interaction of that supplement with the enzyme that metabolizes the drug.
So do you
So,
find that in your experiences that cancer providers, so the physicians, dietitians such as yourself, that they're familiar with these supplements? So if a patient does report taking them, they're able to look at their medication list, their chemo regimen, whatever the case may be, compare it to the supplements and say, ah, we've got a problem, or no, we're good. Do you think, are
yeah,
people well versed?
oh, absolutely not, because there's so many to try to keep up with, and there's many that just have not been studied enough to know what drugs it interacts with. Like that example that I gave of tamoxifen and turmeric, we don't have those types of
Sure.
studies for all these different medications and all the different combinations of supplements and how do supplements even interact with each other. And that takes time to do. So as a provider, I do have access to a database where I can put in different supplements and the medications someone is on and can identify interactions there. But that takes time. And when your provider maybe has 10, 15 minutes in the room with you, they don't have the time to be looking for all of those interactions. And so often I've seen that providers kind of err on the side of caution and say, just don't take anything. If or if they haven't heard of it, like vitamin D or a multivitamin, like I don't know, and just give them that kind of caution. And that's really kind of the state of the evidence right now, too, is we don't really know. We don't know all the possible combinations and interactions that could happen.
Yeah. So really having that discussion and weighing the risk and benefit. What's the potential benefit of taking this supplement and how risky is it given your medical situation and your current drug regimen?
Yeah, absolutely. And something that I have a conversation with patients is when they're telling me that they're taking a certain supplement, I'll ask, what are you taking that for? Like, what benefit do you think you're going to get from that supplement? And maybe their answer is, I heard that it could reduce inflammation. So, well, could we talk about some lifestyle strategies or diet or physical activity, sleep, ways that we can address reducing inflammation through something that's not a supplement? Or maybe you're concerned about you want to get more vitamin C in your diet. Let's talk about foods that could do that as well. So unfortunately, sometimes healthcare providers don't have that time to have that conversation. But as a dietitian, I do like to spend that time and understand what are you taking it for? Could we look at this through a lifestyle approach rather than taking a supplement? And maybe we find out like you don't even need it. If people taking a supplement of, for example, vitamin C is a very common one. I said, you're getting lots of fruits and veggies in your diet. Like you're good on your vitamin C. I don't think this is something that you need to take. So it's weighing those risks and benefits and also providing some options to help get some of those similar benefits without using a supplement.
So what advice can you give our listeners to help them decide if a dietary supplement is right for them?
Yeah, I think if you can set up an opportunity to talk with a dietitian, that's going to be your most personalized approach because
Mhm.
they can do a more thorough assessment of what your diet is like, physical activity, what supplements you're taking, any interactions to really give that personalized approach. But I'll give the advice that I give again to most of my patients is understand why are you taking it? Like, what do you think you're getting from this? What benefit do you think it's going to provide? Are there other ways that I can get that similar benefit? So if you want to, example, ashwagandha is one that's being marketed a lot for helping lower stress. Well, that's not going to make up for that you're sleeping only 6 hours a night and you're overworked and you don't get any downtime. Like, we also need to approach this from the lifestyle approach. Like ashwagandha is not going to offset these other things. So I
Right.
just encourage people to think about, what am I using this for? Can I actually approach this more holistically?
Mhm.
And when it comes to choosing a supplement, some people are like, no, I really want to take this, or my provider said to take calcium for my bone health, I need to take this supplement. Okay, so how do you know that you're taking a quality supplement? In the US, as I mentioned, we don't have to have proof of purity, safety, or efficacy of a supplement before it's allowed on market, but some companies pay for another company to test their supplement to have kind of that stamp of approval that it is pure, that there's no other contaminants in there. And a very common one is USP certification. It kind of has like a little gold label on that. NSF is one that I see more on things like protein powders,
Mhm.
collagen, because they're more sports, or informed
Mhm.
choice is another one that's more sports directed. Consumer Labs also does some testing as well. So that can be a way to help navigate this market as well. Like, okay, doctor told me to take calcium, and you go into the aisle and there's literally dozens
Yeah.
of different calcium supplements. How do you know? One, try to find something that is just the calcium, right? Just
Mhm.
limited ingredient list, and then look for that third party label. Ooh, and I'll add this too. I know Amazon is trying to crack down on this, but big retailers like Amazon and Walmart are starting to crack down on this. But there's been a high incidence of kind of, that's not spoofs, but someone like trying to be that company or saying that they're
Mhm.
that company. I'm blanking on the term there. But essentially, they're selling products saying we're this brand, but it's not actually the product from that brand.
Oh,
Counterfeit. There's the
counterfeit.
word. Counterfeit supplements
Mhm.
on these websites, these big manufacturers. Because think of how many different stores are under things like Amazon.
Sure.
Yeah. And so there has been some big brands trying to come after these little smaller brands that are trying to pretend that that's their product. So there's counterfeit products out there. So really recommend that you try to get it from either your healthcare provider. I know some healthcare providers might have ways that they can prescribe supplements, or getting it from a store directly.
Mhm.
Because again, with this market and everyone trying to get a slice of this $53 billion industry, there's some reports of counterfeit supplements being sold at manufacturers like Amazon, Walmart, online on Walmart. As
Sure.
yeah, like, okay, that 2-day Prime shipping isn't so helpful if you got a bad product and not
Right.
a pure product.
Yeah, no, that's great. And yeah, being very cautious about what you're selecting if you choose to use something. And I would add to talk to your healthcare provider. If you've got a dietitian on board, if not, you can ask for a referral, talk to your physician or your allied health professional, and they can help you navigate some of these waters as well.
Yeah, no, I definitely echo that going back to that statistic you said at the beginning, many have not even informed their provider. Just letting them know it's documented on the medical record. So if there's adverse effects that they maybe have never seen before, like, hey, maybe it is the supplement, but at least you've had that conversation and that's documented. And that's a better place than withholding that information. So definitely open up and tell your healthcare providers about that.
Wonderful. Well, thank you so much for sharing this information with us. It was so great to talk with you this evening. I really appreciate your time.
Yeah, thank you. I hope this information can help people make a more informed choice.
Absolutely. And listeners, remember we do have a library of nutrition, fitness, and mental health resources related to cancer care on our website at fucancer.health. And be sure that you like and follow this podcast wherever you access your favorite content. So until next time, I'm Christina Rollins. Thanks so much for listening.